Hi, you guys. Good morning. All right, this morning we're going to talk about medical gaslighting in the vestibular community. So, that's all things that have to do with, I just walked out of that appointment and I don't feel like I was listened to. That is often what gaslighting looks like. It looks like a lot of things. We'll kind of go over what it means, what it doesn't mean, all those sorts of things. Remember, none of this is medical advice. You don't get medical advice from people on Instagram or over the internet. I am not your doctor. This is not medical advice for you. This is just tips and tricks to avoid gaslighting and to learn what it looks like. As always, at the end, I'll go back up and scroll to look at what your guys' questions throughout this discussion are, and I'll try to rapid fire answer as many of them as I can. They can either be about gaslighting or about something else. You just ask a question and I will go ahead and answer it at the end. Okay. So first of all, let's define, I have my notes down here so I don't mess any of this up. Let's just define what medical gaslighting is. So you guys might have heard of gaslighting before. It often happens in relationships or in families, and it's basically when you are like, this happened, and someone's like, no, it doesn't. That's not my reality. That's not what's happening. In a medical situation, it is when a physician or other healthcare provider dismisses or trivializes your symptoms or condition. So that can look like a lot of things, and it happens so often in vestibular diagnoses. Dizziness and vertigo account for about 5% of all doctor's visits a year, which is so many. If you think about it, like if you think about 5% of every single day someone goes to the doctor, the ER, whatever, for dizziness, that adds up to quite a bit of quite a number of people experiencing this. And more often than not, people are just like, I don't know, or you're given meclizine and sent away, maybe given a referral to someone who might know, but that doesn't always happen. So here is what it often sounds like. So, oh, it's just anxiety. It's all in your head, which technically it is in your head because your vestibular system's there, but you're not making it up. It's not in your head. It's just not that bad. You look like a healthy young person. You don't look sick. There's nothing physically wrong with you. Well, all your tests came back normal. There's nothing possibly wrong with you. We know that tests can come back normal in vestibular disorders all the time, especially with vestibular migraine, and look completely normal, and you can still have a vestibular problem, namely vestibular migraine. So all of these things are really important to recognize so that you are more equipped to go into the doctor's office or going to the place where your provider is, whether it's telehealth or an office or whatever, so that you can represent yourself and your symptoms and try and get help to the best of your ability. So I had some specific questions about gaslighting, and so I'll go ahead and answer those first, and then we'll talk about ways to avoid it, and then I'll go back up and answer you guys' questions. So how do I tell my PT that I feel like they're not listening to me? So first of all, I'm sorry that this is happening from the hearts of all PTs out there. I really am sorry. I hope that this gets better soon. Here are some things you can do. So PTs, we tend to be pretty good listeners. Not all of us. We are the providers that have the most amount of time with you. And if you're at a clinic where you only get to spend like 15 to 20 minutes with your actual PT and then you get shipped off to someone else, you might want to find a new PT. It is really worth investing in a clinic that will give you a specific provider for like the whole 30, 45, 60-minute session that you need. But if you are in that sort of a clinic where they're not listening because they just don't have enough time to see you, find a new clinic. But if you're spending 45 minutes with your PT and they're just like telling you things to do and you're like, this isn't working for me, or I don't like this exercise, or I still feel really dizzy, nothing's getting better, and you feel like they're being dismissive, you can sit down and be like, hey, I just want to chat. I was wondering if we could talk about my symptoms. Like, I feel like I'm not being listened to. I've written down over the last week all the things that have happened throughout my week, and I just don't feel like they're getting better, and I was wondering if we could talk about that. So people in general don't like being placed blame on. And even though it is the person's fault who isn't listening, a good way to go about having a conversation is in a very calm manner where you're like, hey, I've written down and have proof of all the things that have happened this week. And I would just like to go over those with you. I feel like X isn't working, or I really don't like this specific thing. And if they're still not listening and you give specifics and kind of directly talk to that person, then I think it's time to find a new provider. There are so many good resources on how to find a vestibular doctor, therapist, whatever, both in the UK and in the US. So if you don't know where those are, it's AP. For the UK, it's apcivr.com. And then the US, it's just vestibular.org/healthcare-directory. And those are anywhere on the internet. You can just Google, find a healthcare provider, vestibular, UK or US, and the directories will come up. So my next question that I got asked was, my neuro is avoiding my question, shutting them down. Is that gaslighting? So yes, it absolutely can be gaslighting if they are saying like, nope, that's not true, because you know your body best and you know exactly what's going on inside of your head, inside of your body, that's making you feel dizzy and uncomfortable and all of those things. So I think that it is important to recognize that A, yes, that's definitely seems like what's happening, and B, this is how you go about it. So we'll go back to the tips of how to avoid this. Even though you shouldn't have to work extra hard to avoid gaslighting, it does happen and we do need to do this. So so things that are said to you like, there's nothing wrong with you, all your tests came back normal, you look perfectly healthy, seriously, it's just anxiety, you're making it up, any like connotation of that is gaslighting. So yes, being ignored and not answering your questions that you've asked specifically, you can go back and ask them like, hey, I didn't get the answer to this question, can you answer it again? And then they'll have to really go back and answer it. Don't be afraid, they're just people. I know that doctors can seem really scary, myself included. Can seem really scary. I promise I'm not scary, but people are afraid. So, and I completely understand that. Like when I go to the doctor, sometimes I'm afraid. So I get that it can be scary, but remember, like, they're just a person too, and they either don't have the answer or they don't know. And doctors don't like to say, I don't know. So first of all, no one should be afraid of not knowing something. You can always go do research. That's what I usually do. I'm like, I don't know the answer to that, but let me get back to you. They should ask their colleagues. And then someone wants to know if women experience medical gaslighting more than men. The answer is yes. I did do research on this. Marginalized communities are more frequently gaslit than non-marginalized. So LGBTQ, women, people of color, any combination of that, of course, more so. So let's get into how to avoid this, because obviously it happens. It's not fun. We all deal with it sometimes, I think, but that doesn't make it okay. So tip number 1, bring someone you trust. So if you have a partner, a trusted family member, a kid or a child who is old enough to kind of understand what's going on, I wouldn't bring your 6-year-old as your person who, I mean, maybe everyone's different, but if you have someone that you trust, family member, friend, peer, colleague, someone like that who you're like, they definitely know what's going on and they have seen it happen, and I feel like everyone's symptoms go away when they go to the doctor. I don't know if you've had that happen to you, but sometimes you're like, this has been happening for 6 weeks and then today it finally stopped. It's the day I went to the doctor. That happens a lot, so it's good to bring someone with you so that they can really reinforce, like, no, this is definitely happening, whatever their symptom is. It doesn't even have to be dizziness. It can be a headache. It can be a cough, like whatever that thing is. Especially if you look perfectly healthy that day, it's good to bring a person along if you feel like you're not being listened to. You can ask your provider to document everything. So every single healthcare provider, by law, no matter where you are, has to write down everything that happens in an appointment. They write down the subjective, so what you're saying to them. Like if you say, I feel dizzy, it feels like a lightheadedness today. I write that down. We talk about everything you have done that week, today, whatever. Then you do the objective. So that's like objective measures. So I have a 4 out of 10 dizziness, or I have this much pain, or my patient walked this fast, things like that, objective measures. Then you can do treatment and then assessment, so how they did, like your interpretation of the appointment, and then the plan what you're doing next time. At least as what we do in PT, it's really similar in most healthcare professions. It's called a SOAP note. You can ask them to document everything. So if your doctor's like, I am not gonna run that test for you, then you can say, can you document that for me? And this actually just happened to me. Someone was like, I'm not gonna run a blood test for you. And I was like, can you document that? And guess what? Guess who had a blood test? I did. So if you need a VNG or an MRI or an X-ray or something that you're like, I really want that test, and your doctor's like, no, you don't need it, but you have done research and you really believe you need it, you haven't had it before, there's like a legitimate reason that you should get that, especially when it comes to VNGs, you can ask for that to be documented, and then usually people will comply. Not always, because sometimes it really isn't necessary and there's a reason. So that goes to my next thing, is ask if there's a reason. Because if they say no and yes, I will document that, and but still I won't do it, you can ask for their reason. And sometimes they have a good reason. Doctors are doctors for a reason. They're smart. Usually they have intelligent reasons. They should always have reasoning behind everything they do. Like every exercise that I give a patient, it's not just random. There's a reason for all of it. So they should always have a reason. So if it's like, I don't like this, if we're in PT and you're like, I don't like this exercise, I don't want to do it. And I'm like, you have to do this exercise. It's really, really important to you, important for your health. And they say, well, I really don't want to, like, I'll explain to them the reason. And then if they're really like, I just can't do this one, let's think of a different way to do it, obviously. But usually there's a reason behind everything that your providers are doing. So you can always ask for a reason. If they don't have a reason, that's a different problem. If they don't have the reason that they're giving you a test or giving you a medication or not documenting something or documenting something or whatever it is, they should always specify to you what that is. And you can get that in a summary at the end of your appointment as well, if you would like it all written down, if you don't take notes in your appointments. So you can always ask follow-up questions. So what's the reason for that? Why do you think X? So why do you think I don't have this diagnosis that I've researched? Why do you think I am making this symptom up? Why do you think it's all in my head? Why do you think it's just anxiety? Like there's a constant, I am not a doctor of chiropractic. Someone just asked this. I am a doctor of physical therapy, not a chiropractor. So if someone is like, I think X about myself, I think I have migraine attacks, and your doctor's like, you don't, that's not what's happening. You could have a running list of diagnoses that could be in your head. Like when I am thinking of what a patient might have with dizziness, even though I don't give medical diagnoses, I can kind of tell a lot of times if that is so it should always be running through your head of like, you might have neuritis, migraine, Meniere's disease, secondary endolymphatic hydrops, like whatever those things are. So it's like, I don't think you have migraine. Okay, why don't you think that? And what do you think it is? I'm not making it up. I have this pain every single day. And maybe they think, oh, you have cluster headache. Maybe you have some other form of something. I don't know all the diagnostics of these things, but you should always be able to ask what it is and why they think that. You can always ask, what are my other options? So if they're like, you can't have this thing, be like, okay, what do you think is best? What is the best course of action? I want to do something. Clearly, like sitting and waiting isn't working for me. Let's do something about this. So if you don't think I need an MRI, if you don't think I need other tests, is there another doctor you can refer me to? Is there a medication we can try? Is there a dietary thing we can try? Is there an exercise routine we can try? All of those things are important to be able to ask. Next, you can bring a list of your specific symptoms, and when they happen. So I always recommend my patients for at least a week or so, up to 4 weeks. I don't like people to obsess over their symptoms, but it's good to know when they happen, why they happen, what they happen according with. So I have people track the weather sometimes, their food, their hydration, their exercise, and then their symptoms. When they happen, why, if they can find it, draw a connection. And then we look over that list together in an appointment and say, okay, we've drawn some conclusions. And usually by the time they get to the appointment, people have been like, oh, every time the weather fluctuates, like this happens, or every time I eat nuts, this happens. And usually people can do it by themselves by the end of the week, which is great. But if you bring that list to your doctor, you can say on October 10th, I felt really awful and then I had a headache. And so then you can like recall all the things that happened. I had dizziness that lasted this long. I had room spinning vertigo that lasted this long. And that can be really, really helpful in the way that we diagnose things, because a lot of vestibular diagnoses are based on time. So if you have vertigo for under a minute, it's usually BPPV, especially if it's with position changes. If you have vertigo for 20 minutes to 24 hours, that's usually Meniere's disease. Something in between that is migraine, especially if it has an aura. There are criteria that we can kind of go through and say like what you have and what you might not have. And so it's important to have written down what your symptoms are, what they feel like, and we can obviously tease that out in an appointment, but if you have a list, that becomes easier and you might not get as flustered. Have clear goals of what you'd like to accomplish. So some providers I have found actually aren't allowed to deal with more than one thing in one appointment. So I used to work in a clinic with vestibular and orthopedic patients, and I had a patient who had like back pain, hip pain, and knee pain. And the orthopedist was like, you can only ask me about one of those things, even though it turned out they were all related, but that's neither here nor there. You can only ask about one thing. So have a specific goal in mind. Like, I want to deal with the headaches. And even though your headache and your dizziness might go together, it's really common, of course, even though those things might go together, it's good to have exact goals. Like, I want to try a new medication. I want to try and wean off my medication. I want to switch my diet. I want to get referral for a new doctor, whatever. The last thing that I have on my list, there are so many things you can do, but this is sort of what we have time for today. The last thing on my list is get another opinion. I know this is easier in the US than it is in other countries, but you can always try and get another opinion. There are not obviously a ton of vestibular specialists in this country, but many doctors practice in multiple states, myself included. I practice in New Jersey, New York, Virginia, Maryland, and California. Doctors that we all know of, like Dr. Bay, for instance, he practices across the US, I'm pretty sure. He's a neurootologist. There are lots of doctors like this where you can get an appointment via telehealth and see them from your home. You don't have to go to the state where they're located. And so you can always get another opinion and a new doctor if you feel like one isn't listening to you and one isn't trusting you. So that's what I have to say about gaslighting. Let me know if you have any questions. I'm going to go ahead and scroll up. I saw a couple questions, but you can always drop them right here, right now, and we will continue to talk about other things. It doesn't have to be about gaslighting. It can be about anything. Go ahead. So I've done 40 sessions and it made my symptoms worse. So in my case, habituation didn't work. I still take bicycle or car sometimes, even if it's hell when I'm down. Thanks for your advice. I'm glad you find my advice helpful. I'm sorry that habituation didn't work for you. Sometimes it's not the right time to start vestibular therapy. If you are a person who just got diagnosed with vestibular migraine and you're super, super sensitive to all movement and you think that you might need some medication to try and help clear the dizziness, anxiety, vertigo, headache, any of those symptoms, it's oftentimes more helpful to start something else and then come back to vestibular therapy, because vestibular therapy is not, as much as I wish it was always the answer, it's not always the answer. So sometimes it's more helpful to come back to it later. Okay. Yes, someone said, yeah, they don't like dealing with dizziness. I think that's when we were talking about people going to the doctor for dizziness. Yeah, not a lot of providers like to talk about dizziness. I am not one of those people. I love it, but so that's definitely true. Someone says, is there a difference between vestibular migraine and 3PT? Yes. So vestibular migraine is a neurological dysfunction. It is a kind of migraine, just like you would think of a migraine where you have like an ice pick through your eyeball, like the classic, you need to sit in a dark room with sounds. That's one kind of migraine. There are so many kinds of migraine. There's hemiplegic migraine, migraine with aura, without aura. There's just like a billion subtypes that I cannot list. One of them is vestibular migraine. It is when you have a cortical spreading depression. It happens to your trigeminal nerve. It affects your vestibular nerve. Some people get headache with it. Some people don't get headache with it. It's really, really dependent. 3PD, on the other hand, is something that can happen because of vestibular migraine or other underlying conditions. So 3PD cannot happen by itself. 3PD needs an underlying condition in order to be a diagnosis. It's actually one of the diagnostic criteria. You guys can go back to a post I had about this, I think a week ago or 2 weeks ago. It's a carousel post, and it goes through all of the criteria of 3PD. And it's important to understand the criteria because you cannot go to the doctor and the doctor say you have 3PD. It happens all the time. But if you're just like, I'm dizzy, and you have no other diagnosis, you've never been diagnosed with vestibular migraine, Meniere's, panic attacks, neuritis, anything like that, you can't just have a 3PD diagnosis. It doesn't happen. It shouldn't happen. It's in the criteria. So vestibular migraine can be the underlying cause of 3PD, but 3PD cannot happen by itself. 3PD is when you have more than, I think it's 3 months of symptoms of daily dizziness that waxes and wanes, so it kind of goes up and down throughout your day, but it's chronic, it's there, and it happens every day for that amount of time. It is not vertigo. It is not room spinning. It is not feeling like, whoa, like that. It's not that. It is like a dizziness, lightheaded feeling that happens for X amount of time every single day. So it's good to know the difference between the two, but they can absolutely happen at the same time. All right, if there's no more questions, it was so good to talk to you guys today. You can always ask me questions in my DMs. I do not give medical advice ever, but you can always ask me questions about the vestibular system, about vestibular diagnoses. Can cardiology problems cause dizziness? Yes, they can cause dizziness, blood pressure problems, things like that. It's good to get a cardiologist's opinion if your other doctors can't figure it out. It's always a good idea. I've had mine for 4 years every day. Dizziness, you might have 3PD. I don't know. I can't tell you. This is not medical advice. It's something that I would go ask my doctor. Anything is possible with these vestibular conditions for sure. All right, you guys. I'll talk to you later. Bye.